I want to know about self-directed support and individual budgets.
I want a plan for my future health and well-being.
I want...
What
I want
services
my
are
dad
available?
to get the help he needs to remain in his own home.
I
I want
want
my dad to get the help he needs. I want my
I care about my local area
as long
and
as
services
he
that are
stays.
delivered to my friends, my family.
Everybody has a right to a voice, but sometimes single voices are hard to hear. Links is a new initiative that combines these voices to ensure that health and social care services meet the needs of users both now and in the future. This film will explain why Links exist, what it means in practical terms, and how it will affect you as an individual.
Links is short for Local Involvement Networks. It's a new service that will bring together all of the engagement and consultation with the community so that people can have a say about the way that health and care services operate. They won't replace things that are already there, but they'll add to them, they'll coordinate them, and they'll give people a stronger voice. It'll be a network of existing forums, existing organisations, but also individuals with an interest will be able to contribute. So that when we design a new service, or when we change in an existing service, we know exactly what is needed and exactly what is wanted by the people that are paying for them in the borough.
I want information in a format that I can understand and read.
Before Links, there have been a number of ways to be involved with health and social care services. However, they've never been coordinated and they've never given people enough of a say, enough of an influence in the way that we provide services.
I want more choice for my care needs and to be in control.
In the past, there were lots of large but smaller forums, and they were meeting, and they would have a meeting, they'd set the agenda, and they might come to a commissioner and say, this is really important, or that's really important. But what's going to happen now is that they've got a statutory power to ask a question through Links. They'll have a chance to say, we want you to tell us what you're doing about this. They'll have a chance to go into a service and say, this service isn't working properly, or we have these concerns about these service. And they can expect me as a commissioner to answer them, and they can also expect the health scrutiny panel of elected councillors to answer them. So there's going to be much more power than there's ever been.
I care about my local area and the services that are delivered to my friends, my family and my neighbours.
Because Links needs to represent the whole community, they'll be looking for new ways to contact people. It might be that they go to local supermarkets and talk to people in the car parks. It might be that they even go to pubs, football stadiums, that sort of idea. In 2 years, we want the link to be something that everyone in Barking and Dagenham knows, so that everyone has a chance to have their say. Links is going to give people a much greater say in the way that the services they use operate in the future.
I want commissioners to know how it feels to use services.
I believe that Links will make life much better for me as a commissioner. I'll be able to understand what people want, I'll be able to get closer to the public, who will be able to help me to design better services.
So now we know why Links was set up, and its creation in Barking and Dagenham gives everyone a chance to have their voice heard. Regardless of whether you visit the doctor once every 5 years or you need round-the-clock care, the creation of Links means that your voice counts.
Links is up and running. It's going to be promoted heavily across the borough, and we do need to get the general public involved. Links will work closely with not only individuals and members of the public in the borough, but also with various voluntary organisations in Barking and Dagenham. For example, if we need to look at services for older people, then we could link in, say, for example, with Age Concern. If we need to link into groups for disabled access to some of our sites, there's many, many voluntary organisations out there in the borough, and it's vital that PCT and Links link in with the right people at the right time.
I want to find out about how I can be involved in inspecting services as a Links member.
Link members may find themselves in time doing service reviews, or indeed even doing inspections. They may go into a health centre or GP surgery and find themselves speaking to service users, speaking to the staff that work there, and they may ask various questions and get feedback from the users there, and in turn we'll be reviewing what they've been saying and improving services based on public feedback. There's never been a better time to get involved in Links, because if you want to give your views and improve services, then this is the way to do it.
I want a GP to understand the urgency of my health concerns.
It's very important that the PCT listens to the public. They are the service users. They know what works well and doesn't work well. They know what they want from the NHS. We provide you the services, but only once you come to us and give us your views and tell us what you want and what you need, can we actually improve what we provide at the moment.
I'm interested in the future of health and social care in my area and want to have my say.
You can now tell us, the PCT, what actually it is that you need as a service user, what it actually you want from the PCT, and we can, where possible, improve these services, give you what you need. If ever you thought to yourself, what can I do, what can I say, who can I say it to, I've got some good ideas, I've had ideas for years but never knew what to do with it, then I'd say become a member of Links. This is your biggest opportunity to have your say about health services in Barking and Dagenham.
So we are talking about linking different communities, organisations and individuals to ensure that the voice of everyone is heard and listened to. So if you have something to say, here's your opportunity to do so.